Hi, I'm Dr. Kurt Woeller from Sunrise Functional Medicine and Autism Recovery System. Probiotics are supplements that contain healthy bacteria. So healthy bacteria that inhabit our digestive system. So Acidophilus, Bifidobacter, etc. These wide variety of these bacteria that live in our gut. And they're important because there's trillions of these bacteria and we need them for overall health. Because of chemical exposure or toxic food or other chemicals or overuse of antibiotics, sometimes these healthy bacteria get depleted, and that can leave us vulnerable to opportunistic bacteria or yeast and candida issues. Antimicrobial botanicals, so things like grapefruit seed extract or garlic or berberine and other types of herbal remedies can often be very helpful in reducing or eliminating an overgrowth of opportunistic bacteria, but also an overgrowth of digestive yeast as well as candida. So candida actually is a type of yeast. Now, there is a possibility, because these antimicrobial botanicals also have antibacterial properties, that they might limit the amount of healthy bacteria that might be consumed through a probiotic. They're not going to have the same effect or same intense effect that an antibiotic would have on bacteria, but there might be a potential of reducing at least some of the potency of a probiotic. So what we often recommend is, if you're using an antibiotic medication, if a probiotic supplement is being used, it really should be dosed at least a couple hours away from the antibiotic. And the same applies to an antimicrobial botanical. So again, sometimes there's combination products of botanical remedies or singular remedies as well. So the best rule of thumb is just to try to give the probiotic a couple hours away from the antibiotic medication or the antimicrobial botanical. And that way you would reduce any negative impact that might have on the probiotic supplement that is being used, and at least try and optimize the potency of that probiotic. Some people say, well, you shouldn't give a probiotic until, let's say, a course of antibiotics is completed. And that might be 7, 10, or 14 days, depending on how long somebody's on an antibiotic. I've often found it helpful to just use a probiotic during that course of intervention, but just to make sure that we're separating the two so that we're not limiting the potency of the probiotic. Okay? Again, I'm Dr. Kurt Woeller. Thank you.